Welcome to the Propreneur Podcast, where we help practice owners become better entrepreneurs. I'm your host, Dino Watt. And once again, welcome everybody to the Propreneur Podcast. I'm so excited to have you here. My name is Dino Watt, and I have been your host here for the past 100 and I want to say 23 episodes, I think we're at now. So thank you for tuning in. Thank you for being a part of the community. And thank you for all of you that now that we're back to events, have been gracious enough to come up and tell me that they've listened to the podcast, that they enjoy what we do here, because that's what it's all about. We're trying to bring you the best practices for your practice. And today we have both an expert and a professional for our show. As you know, we typically go between either an expert, somebody who actually has a product or a program, and a professional, somebody who's got their fingers wet actually doing the work. And we have somebody who's doing both. Today, our guest is the creator of BRIUS, which is Mehdi Peikar. Mehdi, welcome to the show.
Thank you very much, Dino, and thank you for the invite. It's great that I'm here, and I'm really excited for our conversation.
Yeah, me too. So I was telling Mehdi before the show started that we had actually met probably about 4 or 5 years ago at one of the MKS forums. I think it was my very first one. And I had seen BRIUS over there, and I wasn't quite sure what it was. And so we had a quick conversation, trying to understand how it worked and all that stuff. So I'm excited to dive into this today for our listeners to find out a little bit more about you, first of all, and then about this amazing system that you've created. I always love people who take their passion and create something even more out of it and see, oh man, how can I make that better, faster, smarter, easier for people, not just for the doctors, but also for obviously their patients. So we're going to dive into that. But first, as we do on our show, for every show, let's start off with your story. Let's find out about you, how you got started in this, where you're from, why you decided to become an orthodontist, and how BRIUS came to be.
Of course, great. So, I am originally from Iran. I did dentistry in Iran, and then I did residency in orthodontics in Iran. And maybe the original idea of BRIUS came to my mind when I was a first-year resident in Iran. That was 2007. I was talking to one of my professors, and he said teeth move on average about 1 millimeter per month. And then I was like, okay, so if we do an extraction case, we extract like premolars, and we do absolute maximum anchorage, the treatment should finish in about 7 months because the extraction spaces. So why it takes on average 2 years or about 2 years? And then my professor was like, okay, Mehdi, don't get ahead of yourself. You're not experienced. So maybe you have to wait. You learn orthodontics. And then also I had one of my first patients was a teacher. He was about 40 something years old. He had a lot of crowd. The crowding was a lot of crowding, high buccal canine. And he was very concerned about the braces. He came to the clinic every week instead of every month. And he wanted me to adjust the braces for him. And then I asked him what is going on. He said his students who are 13 years old, very 13, about 12, 13 years old, they laugh at him because of his braces. And before having braces, they were laughing at him because of the crooked teeth. So he wanted to get this treatment done. That's why he came to the clinic every week. And then I thought of this idea that something is invisible, and the teacher doesn't have to come to the clinic to see me. It kind of does everything on its own. And so I came up with this idea of BRIUS back then. It was 2007. I wrote a proposal and I gave it to the School of Dentistry in Iran. And then they rejected the proposal. They said, oh, this is a cool idea, but you won't be able to manufacture it. It's more like science fiction. It's exactly something that they told me. Yeah. And actually, I was looking into my emails, and I found it, the proposal that's in Persian, because in Iran, the language is Persian. So the proposal and that's the idea of BRIUS there. That's interesting. It was like kind of nostalgic to me. I was looking at these like about 2 months ago. But after I graduated, I love physics. I love physics. I love quantum mechanics, and the reason I came to the U.S. was just to study physics. So I came to the U.S. and I started my Ph.D. in condensed matter and quantum mechanics at University of Illinois. But I could not stop thinking about BRIUS. I was just thinking, why nobody is doing it? This makes sense. And then I transferred to Johns Hopkins, that's in Baltimore. I finished my PhD there, but again, I was just thinking about BRIUS. And then to try it on patients, I didn't have a license in the US because I'm an international dentist. So I had to do some sort of either like dental school or residency, something. I had to become a faculty. Anyways, I started my residency at UCLA in orthodontics. And that at that time I was working on BRIUS very seriously. That was basically all my focus. Although residency is already a full-time job, yeah, and especially like UCLA is like more than full-time job. Sure. But I started working on that. That was 2016, and we made a typodont that wax typodont that the BRIUS worked on that for the first time, and I made a video, and also we did all the regulatory because you have to do a lot of paperwork to try a medical device on a patient. So sure. All of that was done, but the problem was an orthodontist who tries it on a patient, because when I was a resident, I didn't have a license. I couldn't try it myself.
Right. So
to convince our first orthodontist, I made that video, and when the orthodontist saw that, say, okay, that looks promising, so let's do it. And we tried it on the first patient, and that first patient, I would say, had generalized spacing, kind of simple case, maybe with Invisalign. If the patient was compliant, it would have taken 6 months. And I placed the BRIUS for the patient, and about a month and a half later, the patient came back, and I looked at the patient and I said, okay, actually the treatment is done. We are done. Yeah, that was a milestone for BRIUS back then. And that patient actually started crying. That day was her birthday. I didn't know about it.
Oh, interesting.
Just accidentally, that was her birthday. He said, oh, this is the best gift. I talked to other orthodontists. They told me it takes 6 months, and now my teeth are straight. And so that gave us a lot of motivation, encouragement to continue. And also the orthodontist was very encouraged. So, wow, this was quick. And the rest is history. So that is the story of origin of BRIUS and our
That's
first
awesome.
patient.
I love it when you just are like inspired by something, and when you said that you just couldn't stop thinking about BRIUS. I know that feeling. I've had that before with, I actually have that right now with a couple of projects I'm working on where I just can't stop thinking about it, and the way I see it in my mind's eye. I can try out little things here and there. I want to actually back up for just a moment though, but what made you want to become an orthodontist when you were a little kid? Like, was this something that you had always aspired to be? Was it kind of happenstance? I know you like the physics part of it, which is great, but what inspires you to be an orthodontist?
Yeah, so as you said, physics. I love working with patients, so that's one thing. And the other thing, actually, I had two options. One was ophthalmology, light, and physics of light. The other one was orthodontics. They're very different. But when I was in high school, I decided I'm going to be an orthodontist. I was in high school. I knew that. And in Iran, the system is that you go to dental school for 6 years. So, that's how it's like similar to Europe. It's not like in the US that you do undergrad and then you do dental school. So from high school, I knew that I'm going to be an orthodontist. And I love the biomechanics part of it. This really amazes me. And, BRIUS is based on biomechanics. Everything is biomechanics. Everything is calculated, the forces, the moments, for example, like recently, we are getting the results of some canine impaction cases that with two BRIUSes, we brought a canine from the nose into the arch, and we are fixing its torque. And everything is calculated. We know how it works. The first patient, that patient that I told you, it took me about 200 hours to do the design. I had to do a lot of simulations because BRIUS has that anchorage base and has those arms. Mm-hmm. And each arm, the design and thickness is different from the design and arms of, they are all different. Even I did a calculation statistically. If we have 10 million patients, not two of these arms are going to be the same. Wow. It might be very similar. For example, the thickness could be like 0.3000 millimeters. The other one could be 0.3001 millimeters, for example. It's going to be very close, but it's going to be different.
Right.
Right now, I don't have to do any calculations. Just the software does all that. And, the design of the BRIUS and thickness of the BRIUS and for each tooth will be determined and it takes like just a few minutes that the design will be done.
So let's get into it a little bit. Let's find out a little bit more around the idea around BRIUS, right? Because it's not a braces systems. I know a lot of people think about it as, traditional brackets or maybe IDB or whatever in that sense.
Right.
What is really the difference between traditional braces and what BRIUS does?
Yeah, of course. So, traditional braces, we had, let's put it this way. We had traditional braces for more than 100 years. 20 years ago, we started using aligners 20 something years ago.
Right.
And then right now, this is a completely different category of tooth movement. I call it independent movers.
Okay.
Its biomechanics is completely different. Its workflow in the clinic is completely different because I just see BRIUS patients. I don't see braces patients.
Interesting.
During my residency, when I was seeing braces patients, I was thinking, why am I doing this? Because I had to get my license, but I had to do braces. But I knew that these are the last braces patients that I'm going to see in my life. There's not going to be any braces right now. I do only BRIUS. The fact that the arm grabs that tooth, that bracket, the slot doesn't matter. We can do any bracket that you can imagine. I have treated patients with the speed bracket. I have done Damon. I have done Innovation L. I have done Adenta. Just you need a handle on the tooth. That bracket, for example, like seat belt, the way that we do seat belt. So that bracket could be like that. That bracket could be just you need a handle on the tooth. And the fact that some people see it for the first time and say, oh, this is lingual braces. This is completely wrong. Because braces, they work with wires. BRIUS is not wire. It's like somebody calls an aligner braces. It's completely different system. Its biomechanics is different. Its workflow in the clinic is very different. And the same for BRIUS. I call it the third way of moving teeth. I call this category independent movers because each arm moves each tooth from its initial to its final position, independent of other teeth. But by independent, I mean like relative independence, because when you are moving a tooth, still you affect the whole arch, but the reactive forces is going to be applied to the whole arch uniformly. With braces, when you are moving a tooth, the reaction force, maybe more than 90% of it, is going to be applied to two adjacent teeth. So that's why the biomechanics is very different. Recently, we did a research on OSIM, it's ortho simulator at University of Alberta. And it clearly shows when you're moving a tooth with BRIUS, the reaction force is going to be applied to the whole arch. But with braces, we compared it with braces. You are affecting two adjacent teeth. And usually those reactive forces are negative. and you cause round tripping. And with BRIUS, you don't have that round tripping, and that has a lot of advantages. Obviously, I haven't done any peer-reviewed research on that, but we don't see root resorption just based on my observations. And there are several reasons here. One, teeth move independent of each other; they don't round trip. The other thing is that you are applying a very light force to the teeth with NiTi. With traditional braces, when we step up the arch wire, suddenly the force goes up. We put a power chain, the force goes very up, and then it decays very quickly. These all will cause root resorption. But with BRIUS, we are applying force, very light force, with NiTi from the very beginning of the treatment to the end of the treatment. And the interesting thing about BRIUS is that we can treat any case. I have treated extraction cases. I have treated protraction of molar. For example, in one of my cases, we protracted the molar 12 millimeters. We had to extract 6, and then we moved 7 and 8, about 12 millimeters, and we moved it bodily. So
Wow.
all of these is based on biomechanics. We do all the calculations, and obviously I am biased. I am the inventor, but it is so exciting when I think about the potential for BRIUS. Is crazy. What we can do. I have treated orthodontic surgery cases. I have used it with TADs. Simultaneously you can use it with TADs. For example, I use benefit TADs. You put the TAD there, and then the BRIUS sits on top of it, and then I have started several cases with those. For example, you can intrude the whole upper arch with BRIUS, or you can extrude the whole upper arch with BRIUS.
So if I remember correctly, when we were talking before, the idea behind the, not the bracket, but the wire, if you will, the BRIUS system, is that it's programmed wire. So that wire is, when you place it, you're only placing, if I remember correctly, you're only placing the one wire. And that one wire is doing all of the work for the months or whatever time periods necessary for the teeth to move. And it's just kind of slowly moving everything, almost like robotics in a way, the way that it puts it together. Is that correct?
Yeah. So, one thing is that, when I look at it, I would say this is more like a tiara. It's not a wire.
Okay. Tiara.
Yeah, because, I would say the differentiation between the third way of moving teeth, independent movers, and like braces, is that always with braces we do wires, but with BRIUS we don't do. Wire, the thickness usually is similar everywhere, is exactly the same or is similar. We can do like some changes in the wire, but with ours the customization is very very like beyond like aligners or traditional.
Yeah, because it customizes the thickness of the wire, the girth of the wire, if you will, even the movement or the track, if you will, of the wire.
Right.
Like when it was explained to me, I kind of saw it as it's this kind of road or road map, if you will, of the back of the teeth. And which, by the way, I'm going to ask you a question about that, but that it actually just moves it along so until it's to the placement that you want it to be.
Right. Yeah. So as you said, you put one BRIUS there, and each tooth moves from its initial to its final position. With mild to moderate cases, if the bracket positioning is accurate, you can complete the treatment with just one BRIUS. You don't have to go to the second or third. But obviously, if you have more complex cases, for example, a molar protraction or a canine impaction, you have to go to the second BRIUS, or sometimes if it is too complex, you have to go to the third one. But everything is, all the biomechanics is inside that one BRIUS. And the reason is that with braces, when we have a wire, for example, we have a very crowded canine, but the rest of the arch is pretty good. We cannot step up the arch wire until that canine is aligned, right? So we have to start with 014 nitai. So we are wasting time. That efficiency is not there. But when you have BRIUS, the arms for example, molars that they are aligned, they're going to be pretty rigid. They're not moving those teeth, but the arm for that canine is going to be flexible such that it applies the right force to move it from its initial to its final position. So we don't have that step up arch wire system that we have with braces, compared to BRIUS. The other thing is that, lingual, some people see
why lingual, why the back of the teeth?
Yeah, very, very good question. So we can put BRIUS on the buccal. I have treated many patients on the buccal. And I have treated some patients that I put the bracket on the occlusal surface. For example, if you have a semi-erupted 7, or you have a canine that is semi-erupted, I put the bracket literally on the incisal edge, or I put the bracket on the occlusal surface of the molar. So if somebody asks, BRIUS is a lingual system, the answer is no. It's the third way of moving teeth. It could be a buccal system. It could be an occlusal system. It could be an incisal system. Just you need a handle on the tooth. The arm grabs that tooth, moves it from its initial to its final position. So why we do it on the lingual side? These days, aesthetics is very popular. Aligners are growing so fast, and the reason is that aligners are pretty aesthetic. Although when you go closer to the, you see the aligner there, or you see the attachments, they are not like truly invisible, but BRIUS is invisible. And the process of bonding the brackets and indrik bonding, basically, if you put it on the buccal or on the lingual, they're pretty similar. If somebody is comfortable with indrik bonding on the buccal side, usually they can handle on the lingual side very easily. Just they have to be careful about NOLA and isolation and everything. And engaging the arms on the lingual side, after they do it a couple of times, it's pretty easy. In the clinic, I don't do anything. As far as like working with patients, I just go talk to the patient the first visit, and I explain how the process is going to be, and my assistants take over. So with BRIUS, a very important factor is training the staff. We have to train the staff to do that for you.
Yeah, that's one of my questions is that I had written down here was what the learning curve, right, for both the doctor and the team members, right? Because I can understand where you have some doctors' resistance being, I got to learn a whole new system on how to treat patients. If it's not braces and it's BRIUS, like it's a totally different thing. What is that learning curve like for most people?
Actually, we have a very supportive clinical team that, we work with doctors, and also we work with the assistants, because both of them are very important. For doctors, sometimes they ask me, okay, for virtual treatment planning, what should we do? I say, just look at the treatment plan. If you like it, approve it. It's not like aligners that you have to do some overcorrection. So that's why learning curve for doctors in terms of virtual treatment planning is very easy. They just, if they like it, they approve. If they don't like it, they don't approve it. And for assistance, this is indirect bonding that is the challenge. Because sometimes patients, assistants, actually, you talk to them, or doctors, you talk to them, you say, have you done indirect bonding? They tell you yes. And then you say, when was the last time you did? They say 15 years ago.
Sure, right. Yeah.
I did that. And so that does not count. And the same for the assistant. If the assistant has done it once, that's, although, like when we do the attachments for aligners, that's kind of indirect bonding, so I would say assistants and doctors are familiar with that, but it needs some learning. We need to train them. We need they feel comfortable about this.
Is there an average like time frame that most doctors should be able to get comfortable in it?
Usually with BRIUS, we have like 2 visits that we support our doctors. If they
Oh, wow.
request, we do more, but we go to their clinics and we help them. We have like we call those days BRIUS days. They have like, let's say five, 7, or how many patients, and they schedule them like each 1 hour, and then the assistants, they do the first one and second one and third one. That's going to be their BRIUS day, and they get comfortable with it, and all the assistants try the bonding the brackets and also engaging those arms. And then if they need, we do like a second visit to make sure that they are comfortable with that. But as I said, indirect bonding is the challenging part of it, that even sometimes we think we know, but we really don't know, or we don't have the tools. For example, I have been to the clinics, they don't have NOLA. I was like shocked that like if they don't have NOLA, the isolation for especially lower is going to be a little bit challenging. So they need to be prepared, and if when they learn it, it's going to be very easy. The other part of our training is the treatment coordinator. I remember one of our doctors, like earlier doctors a few years ago, he was so excited and wanted to like start a lot of cases. And then I went and I talked to the treatment coordinator and said, can you explain it to me a little bit? Because patients ask me questions. I only have this brochure and I give it to them, and I pray they don't ask me questions. So, we have to train the treatment coordinators, the doctor, and also the patients.
Absolutely. That treatment coordinator is the one who's got to be able to sell it, explain it, make them feel like it's the top choice that they can choose from. Because you do have your traditional, your aligners, your clear, brackets, whatever. So why choose this? And let's talk about that, because we can see where the benefits for the doctor, right? The doctor is giving people another option. The customization is a big deal, right? To go make sure this is customized to you. The lack of time in the office, right? I'm assuming there's less appointments for these, right? For those are all great benefits. But as we're thinking about our patients, what are the major benefits for a patient to go with BRIUS as opposed to traditional?
Yeah, of course. So I would say big part of it is aesthetics. With braces, they don't have that option, and in many cases they are difficult, or we don't have the compliance of the patient. And with BRIUS, we don't have any limitation for complexity of the cases, and obviously we don't have the problem with compliance. So like the advantages of braces, that it's not aesthetic, but we can do complex cases. We don't have to rely on the compliance of the patient. And also advantages of aligners, that okay, we cannot do complex cases, we cannot deal with non-compliant patients, but it's aesthetic. So we have like a combination of both. And also we have that advantage that we don't have to do any adjustments, and we cannot do adjustments. With NITA, you should not do adjustment, because sometimes doctors ask, can I like bend it? I say, no, don't do that.
Don't touch it. Yeah, you're gonna mess it up. Yeah.
Yeah, so that that save the profit per visit definitely increases. It's a no-brainer for our heavy users. If you start like I don't know, like a few BRIUS patients, the flow of your clinic necessarily, it doesn't help with profit per visit because it interrupts the flow of your patients. But if you are a heavy BRIUS user, right now we are like checking with our doctors that they either have switched to BRIUS 100%, or they're like getting close. For them it's very obvious. For example, I had some patients. I live in Dallas. I practice in Dallas, and we had this patient from San Francisco. She went to UCSF, did the scan, and we made the BRIUS for her. She flew to Dallas. I placed the BRIUS for her. She flew back to San Francisco. 5 months later, came back. I removed the BRIUS for her. And that was not a simple case. That was 7 millimeters of crowding on the lower, 4 millimeters of crowding for the upper, although the patient was class 1 and no sagittal issue. And I was done. When I removed the BRIUS, after 5 months, I gave 2 refiners. And by refiners, I call, the liners that we provide on top of the brackets for the patient, I call them refiners. I gave 2 refiners to the patient and treatment was done. And, I said the last refiner, just use it as your retainer. So, in my clinic, I see the patients every month because I want to take photos, I do presentations, and I have to use it for lectures and those sort of things. But in a normal clinic, they really don't have to see the patient unless something breaks, or they have to do IPR, or they have to do some sagittal correction, or some elastics, they should put buttons. Other than that, they don't have to see the patient. Just what I say is that bond the brackets, place the BRIUS, and let it cook.
Wow.
Yeah,
that's
so
really cool. That's a really neat gift and opportunity for the patients and the doctors too. You mentioned your practice, which makes total sense in your clinic. Your full BRIUS brace is all you do.
I only do BRIUS. Yeah, I don't do any braces anymore.
How much of the 2 questions? Number one, how much of an advantage does that give you in your community, I guess you will, right? Because you're full, it's like a doctor being only Invisalign, right? But you're only BRIUS, so there's a competitive advantage there.
Yeah.
But on the other side of that, how do you market that? Because I'm sure there are doctors out here who either are part of the BRIUS program, they offer BRIUS, or they're thinking about it.
Right.
What's your marketing like with that? How do you get the message out there that this is something you might want to really think about and for your patients?
Yeah, of course. So marketing for patients, I would say it's pretty easy. I had some patients that patient drove for 3 hours.
Wow.
And came and said, okay, I want to get BRIUS, and I am an engineer myself. It totally makes sense. I want to do it. I saw your testimonials on your social media. I want to get it. And I was like, okay, you really don't have to drive 3 hours. I know a doctor close to you. So let's I refer you to him. You don't have to come here. So, that is a huge differentiator factor. In 2009, 2010, if you were doing aligners, you could differentiate yourself. Right now, obviously not anymore, but with BRIUS, definitely that's a huge factor. I think especially for younger orthodontists, that could be very helpful when they start their practice.
It really differentiates you from everything else that's out there.
Yeah, and when you talk about your cutting edge, the latest technology, definitely that helps.
Yeah.
And the other thing I noticed, when I remove the BRIUS for patients and I give retainers to them, I hear it a lot. They say, can I have the BRIUS back as my retainer?
Oh, really?
Yeah, because with retainers, like SX retainers, I do SX retainers usually. They really have to put it back, remove it, and the challenges with that in front of others. If they want to eat, they go and they have to remove it. The saliva is coming out of the. It doesn't look good. So I hear it a lot. They say, and also they say it's more comfortable to have BRIUS, which is a little bit counterintuitive for people who have tried lingual braces. They have that mindset. That's also it. You talked about marketing. Our marketing challenge is more doctors, because we have to make them unlearn things.
Yes, I can totally see that.
Learn the third way of moving teeth. So that's the challenge that we have. For example, when I talk to our doctors, they say, oh, I want to use it for adults. That's a good tool to have in my clinic. And I say, this is totally wrong. What you say, BRIUS is for teenagers. It's not for adults. This is for teenagers. When you talk to, after a month, I talk to teenagers. I say, okay, how was it? They say, oh, it was, I hear it all the time. I hear it from maybe 70-80% of the teenagers. They say the same thing. They say, yeah, nobody knew I had BRIUS. They didn't believe me, but my teeth was became straighter, and then they couldn't believe me. And then I showed them, and then they believed me. This is really cool. And I say, okay, did you have pain? Did it affect your speech? And then many of cases they say, oh, I don't remember. And I say, okay, that's great. If you don't remember, that's a good sign.
It's traumatizing, so that's good.
Yeah.
Well,
although for adults, for adults, it might take a week or two until they get used to it. As far as comfort, irritation of the tongue goes away.
Yeah.
And also, it might affect their speech. So setting the expectations for adults is very important.
I bet. Yeah, for sure. So you mentioned a moment ago in your social media, I'm assuming like this is a really great area where you can show off all the great case studies, how BRIUS is different. And if you are connecting with influencers or micro influencers around this, that's going to spread the word a little more and a little faster around, oh, there's another option here. So are you guys use your social media quite a bit to do that, to market?
Yeah, although we haven't really started our marketing, to be honest, but yeah, on our social media, you can see, and actually it's very interesting. Like last night, somebody was just posting things. He's an influencer. He had like 120K followers, and she just started like doing stories about BRIUS and how her teeth are straighter. And we didn't even talk to her. She just did it herself. That was interesting.
That's the best type, right? That's the best
Yeah.
type of marketing, the best let it people like authentically say, check this out, look what I've been able to do. And look at it. I'm telling you, as a company, obviously, and I know you're not a startup, but you're a younger company, to be able to utilize social media and show people here's something else you can do that's different. That's going to be super powerful.
Absolutely. As I said, we are dealing with moms, and we did some surveys, and we just said, okay, these are the advantages. For example, Johnny, by Johnny I mean like the teenager, can floss, for example, and the treatment is going to be like, you don't have to come to the office those many times, and like all those advantages, and it's a no-brainer for moms to use that. That's very interesting that some moms, or like patients, some of them care about one advantage, the other one cares about the other one. For example, I had some patients, they said, I just want BRIUS. I started BRIUS because I can easily floss. That was the whole, they really can. It's kind of rare to have such good patients that care about flossing.
Yeah.
Because there is no wire connecting the teeth. So, flossing is very easy. And like, some other patients, they say, okay, I wanted an invisible option, and my case was too complex. I couldn't do aligners, and then this option, I can do BRIUS.
So all of those things I could see as being little social media posts, right? So
yeah,
just from my 2 cents on the way you're building this business is get more people just talking about that. Can you floss like a normal person for your braces? I can. Or the aesthetics of, look, you can't even tell I'm wearing braces, and have somebody do like a time lapse, right? Or pictures of their face for the 3 months and see how different they are without having aligners or braces. Like all those little things are great social media posts, because the more you get people involved, especially like you said, the youth, this is for the youth. This is a great product for teenagers to be able to say, check this out. I don't have to worry about this, about having braced face, if you will, like I had when I was a kid, right? Metal mouth. And even though it's not as much as a stigma nowadays, it's still a matter of aesthetics. It's still a matter of people are on Instagram and they want to have that Instagram smile, or they're on Zoom, right? So I think there's a huge play there with your social media. That's awesome. Can I ask you what's next? Like where are you launching off to? Like what's the future for BRIUS?
Yeah, great question. I'm really excited for the future. We haven't even started. That's how I see it.
Wow.
Again, like I'm the inventor. I am biased, but based on what I see and the results, I call it force moment enhancement. That's in the software that it adjusts the force and moment based on like the data that we have for the patient. For example, with traditional braces, you never say put a power chain for the upper jaw or lower jaw, or you don't say put a power chain for a 12-year-old. You don't say put another power chain for the 52-year-old, right? All the power chains are the same. We don't care it's upper or lower, what the age of the patient is. But from the data that we have already, age affects the force and moment dramatically. But with traditional braces and aligners, we treat all these patients the same way, the same arch wire, the same bracket, the same force. And this is something that, we can definitely improve. Right now, with this force moment enhancement that we have in our system, we look at even ethnicity of the patient. For example, what I have seen with African Americans, the force and moment is different from like other ethnicities. For other ethnicities, it still is not very significant, but when we have more data, probably it's going to show up. But age is obvious. It's there. When a patient is a teenager, the forces and moments should be to have the optimal force and moments for the most efficient treatment. Is very different from like a 70-something-year-old. Or gender also affects the force and moment. So we haven't even started. And this is something that we cannot do with other systems because of the factor that we don't have friction, and because of the factor that we are moving teeth independently. When the teeth are connected to each other, when sometimes one tooth moves faster and it's not predictable. For example, you are closing the space on the right and left side. Right closes much faster than the left side. It affects the other teeth, and prediction of future is going to be hard. But when you are moving teeth independently, you still can enhance the forces and moments. And there is a lot of room to make BRIUS more and more and more efficient in the future.
I can see like with technology, obviously this is way in the future, but I can totally see where in the future you're going to have the nanobot technology that actually can go into the BRIUS system or whatever, and you can program it from outside the mouth to adjust here, move that there, and it be actually moving inside. That's just Dino science fiction again, but I like actually, I'm going to bring it all the way back to the beginning. I like that the school told you this is science fiction. I see that as a compliment of like, yeah, that's right. We're thinking of the future. We're thinking of how we can progress this industry or that people's health around their teeth in a different manner, in a different way. And yeah, if we can do that, cool. So let it be science fiction. I think that's awesome. I think what you're doing is really cool and interesting. And I know nothing about biomechanics. I just know what that thing does is pretty cool. So
thank you very much, Dino. Thank you
for that information. I know we could talk about this forever, and you are passionate about what you're doing, obviously, and I think it's so cool. We've come to a point in our show where we go over our 6 questions we ask everyone. Are you willing to play?
Of course, let's do it.
So these are rapid fire questions that we just go through, and you just give me the first thing that's off top of your head. All right, the first question is, what is the one thing that every practice owner is missing in their practice right now? I'm sorry, the most expensive thing that every practice owner is missing in their practice right now.
So maybe CBCT, like that's something that, because for all of my patients, I do CBCT, and when you see the roots, I'm again looking at from the lens of BRIUS. When the root is shorter and longer, that will affect the force and moment. So it is going to be important. And also in the treatment plan, if you don't have the CBCT, you might move the roots out of the bone. And, I have some slides in my presentations, the occlusion looks great, but when you turn on the bone, because if you submit CBCT to BRIUS, you're going to see the bone. There are 2 treatment plans. Both of them look great, but when you turn on the bone, one treatment plan, all the roots are out of the bone. The other one, they are inside the bone. And with BRIUS, you can move the roots very efficiently. So that's what I hope that soon all our orthodontists will have CBCT in their clinics. And when they submit BRIUS, we see CBCT. Although even if they don't, we just consider the length of the roots are average of the population, and we still do that.
All right. What is a book that you believe every practice owner should read?
I read a book, When Breath Becomes Air. I really loved it. When Breath, it's about a neurosurgeon, and I don't want to be a spoiler. I don't want to destroy it, but this is a great book. I think I really loved it when I read it.
Cool. I love it. I'm a big book reader. I love being in recommendations for books. That's awesome. When breath becomes air.
Air, yeah, it's a great book. Yeah.
So in my book, The Practice RX, I focus a lot on team culture and team performance as the foundation for business growth. What do you see as the biggest challenge that private practice owners are facing with their teams and their office culture when you're talking to doctors, when you're out there, speaking at events? What do you see as the biggest challenge that they're facing?
What I see, there are two ways to look at it's like a philosophy thing, but two ways to look at your practice. Helping your patients and making smiles and making people happy. That's one way to look at it. The other one is having a great business and having everything, a good culture and everything, making the patient happy to have a good business. I think they look the same, but that changes the foundation of the practice dramatically. I think if you want to make the patients happy, you're going to have a great business. So
no, I agree.
That's how I see it. I think the goal should be, when I go to the practice, I want to make a smile. I want to make a lot of smiles and I want to make patients happy. That should be the goal. And then the business will take care of itself.
Interesting. That's great. Thank you for that. All right. So how can listeners reach out to you and get to know more about you and BRIUS and all that?
Yeah, of course. So, actually, it's very interesting. A lot of doctors contact me on Instagram. They can message me on Instagram at Dr. Peikar, DrPeikar, or they can email me at mehdi@brius.com. Mehdi is Mehdi. Sorry, these are Persian names. It's a little bit difficult.
Oh, that's great.
But yeah.
Well, I think I highly recommend people do that. Like, just get more informed. One of the things that we want to do in this show is just inform people about opportunities and how they can treat their business more like a business and see what other opportunities they can give to their patients. And it's worth a reach out and finding out, what else they can do. All right. So number 5 is a pretty deep question, but again, it's just something that you don't have to go, crazy with, just off the top of your head. What's the best advice that you've received in life or business?
So minimize your regrets. I think it's the Amazon founder that said that. Those things that you regret are usually things that you didn't do. They're not things that you did and you failed. And I really believe in that.
That's a really good point.
Yeah, because when I came to the US, it's kind of crazy. When I wanted to come, actually in Iran, I could have a very good financial situation after doing residency in be an orthodontist in Iran. And I left. I became a very normal student starting from zero in the US. And I remember a lot of my professors were like against it. They said, what are you doing? I remember one of my professors called me and said, without saying hi, said, did you have a concussion? Did you have what happened? And I followed my heart, and I knew that it doesn't seem logical to study quantum mechanics, relativity, but I loved it and I enjoyed it and I don't regret. Even financially, probably I am way behind my colleagues because 10 years ago I could be an orthodontist, but I loved it, and I think everybody should do that. If you think something your heart tells you should do, you should do it.
Well, I love that you said that. Minimize your regrets, and it's true, right? The things that we regret in our life are typically things that we've never done, but we're not focusing on the things we've done and failed and what we've learned from those. I love that. That's a great point. Well, gosh, I can't believe our time has come and gone, but thank you so much for being a part of the show today. And you've just done an amazing job. I love seeing what you're doing with BRIUS. I'm glad that we were finally able to get you on the show to talk about it. Dr. Peikar, you've just been doing great stuff. So thank you so much.
Thank you very much, Dino. I really appreciate and I enjoy talking to you. And I hope soon we can meet in person again.
Yeah, absolutely. Now that we got some new events that are happening live, that's great. Well, Thank you, everybody, for listening to this episode of our show. As always, our goal here is to help you find the best practices for your practice. And again, thank you so much for sharing it with your friends and colleagues. Don't forget to subscribe so that you know when we do have new episodes that go up, they can pop up into your notifications and you can make sure you don't miss a single episode. Until the next episode, remember our goal here is always to help you be more proactive, productive, and profitable in all areas of your life and business. We'll see you on the next show, everybody. Thanks so much again for listening to the Propreneur Podcast. We really appreciate your support. If you haven't subscribed already, please make sure you do so. Also, if you feel like you might be a good fit for our podcast as a guest or know somebody who you think would be, go ahead and email us at dino@dinowatt.com. Again, thanks for support. We'll see you on the next episode.